in its first after. Thank you so much, everyone. I was on mute. Thank you so much, everyone, for joining in this evening's kick-off. Charms Medi Helps Foundation's first annual Black History event, which will be a month long. A month long, y'all. We ain't taking no breaks. We coming with heavy, heavy hitters. And so tonight, our kickoff event, we are so proud and honored that we have Miss Jessica Adams. Not only is Miss Jessica Adams a professional in her field, which is health insurance, but she is also the newest member of the Charms board. So we are so happy to have her, and we're looking forward to all the exciting things that she will be bringing to us and helping us to reach that group of African Americans who we can't, we might, as older adults, we might be able to reach them, but them having someone on point that knows what they're talking about, goes through and knows that lingo and all that, God blessed us. That's what that was. And so it's important for us during this Black History event, which we've named the Black Health History Month, that we come to the African American Black community, and we talk about those things that are important to us. We talk about those things that we didn't know about. Like during this month, if you don't walk away with learning at least one thing from our events, yeah, we need to talk. We need to have a side talk. We need to talk because the items that we will be discussing during this month-long event, once again, are topics that are important to us. We can no longer sit on the sidelines and blame anyone. We can't say, oh, well, this person's fault, that person's fault, the other person's fault. Our ancestors are looking at each of us and they're like, go, 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 yeah, teach, because they didn't have that opportunity to. They had to sneak and teach. So, as I tell everybody that asks me, they're like, Sandra, you doing 29 days? I'm like, you got that right. They assigned us the shortest month in the year. So, we're going to take full advantage of that shortest month in the year. If you have questions where you would like to ask Jessica or myself, please go ahead in that react button and please click on, do the react, raise your hand so that you can come up on stage so that we can hear about those questions. Before we do get started, what I do want to do is I want to take the time to say to our sisters and brothers in Canada who also celebrate Black History Month. They just celebrated, I believe they celebrated in October. So they celebrate Black History Month, as well as Canada also has a Black History Month. So, woo, woo, we're not the only ones. However, we are the ones that have the shortest month assigned to us here in the States, which, we can't change that, but we need to make sure that they know that we're here. We're not going anywhere. We have a ton of wealth as far as talent and gifts in the African American community. And rest assured that before the end of this month is over, they're going to take notice of all that talent that's floating in the African American community that's touching on topics that should have been touched on before that for some reason just weren't touched on. So we're going to do that today. We're going to do that tonight. And I'm going to start with Miss Jessica. But before I start with Miss Jessica, like I told y'all, Charms don't fool around. We're like, our people have already gotten the short end of the stick. They already are not getting what they're supposed to get. So we're not going to Sally Sue and Bobby and Jody and all them folks. We're not going to them. We're going to the senior subject matter experts, and we're asking, can you help us uplift this? This should not have been the first year that a program of this magnitude has taken effect. This should not be, but it is. And hey, Charms is here, and Charms is going to bring it all the way live. So with that in mind, I'm going to go ahead and read Miss Jessica's bio. She is a dedicated and collaborative leader committed to cultivating, nurturing learning environments through inspirational and engaging teaching methods for diverse learners with over 5 years of experience in developing and delivering comprehensive customer service training programs. She has a proven track record. Yo, this is a young lady that has a proven track record as an accomplished training facilitator in enhancing team performance and customer satisfaction through engaging hands on instruction and targeted skill development. She is skilled in identifying training needs, creating impactful curricular enhancements, and fostering a culture of continuous learning. She is a gifted observer with a knack for problem solving, proficient in leveraging innovative training methodologies to drive tangible improvements in service quality and efficiency, as well as having the ability to focus on the big picture without losing sight of the details. She is adept at mentoring and guiding teams and peers to exceed metrics while ensuring a positive and dynamic learning environment. Jessica's passion lies in teaching individuals how to maximize their health insurance, ensuring that they receive the care they need without bearing an overwhelming financial burden. She finds fulfillment in increasing awareness and knowledge within underserved communities, providing them with resources to make informed decisions. This commitment aligns with her personal mission of teaching and aiding others in achieving a better understanding of their health insurance. So before I introduce and turn this event over to Miss Jessica, where we can all sit back and do what our mission for Charms says we do, which is patient empowerment, patient engagement, and patient education. Before we get there, I want you all to show Jessica some love by hitting that react and giving her a heart to show her that we're all here with her this evening. We're listening, we're learning. And for those of you that are on Facebook listening, please do send her some love, send her some comments, send her whatever you can send her so that she knows that she is appreciated, because she could be doing anything. Y'all, she a young lady. She could be out here doing anything. When she heard about our mission, she was like, I'm going to stop this train right here and I'm going to do something with this. So thank you so much, Jessica. And I'm going to go ahead and go put myself on mute, and I'm going to allow you to take over the show.
Wow. Well, thank you very much, Sandra, for that very warm welcome. I don't really know how to follow up after all of that, but it was greatly appreciated. Thank you for introducing me. I'm very excited to be a part of Tom's at this time and joining the board. I am, as you mentioned, very new to the team. So looking forward to all of the new upcoming events and things that we have moving forward for the next year. I'm excited because it's also Black History Month, y'all. It is the first of the month. So I'm energized by that as well. And as we mentioned, we're going to take all 29 of those days. We started out with a week, and then we expanded to 28 days. And this year is leap year. So we're going to take all 29 and continue to be a part of this 365 being Black and being invested in this culture. So I'm excited to spend some time with you all this evening to talk to you a little bit more about as Miss Sandra mentioned, my passion for health insurance and really helping our younger community really understand about the importance of picking plans and understanding what's happening in their lives, and they're starting to transition, right? We can't stay young forever. I know there used to be a song. I might be showing my age here, where I'm talking about I don't want to grow up, but I'm a Toys R Us kid. Well, they don't have that anymore. But yeah, that is the tune that so many are singing. I know I sometimes I felt like I was singing that, but you can't stop time. We have not all found the fountain of youth yet. So, life continues. And so, as life continues, there are things that we need to take into account and think about our own health and how we're going to survive. And people don't really prepare us for that. I learned going through school, you just go through the motions, right? In this country, they don't really prepare you, especially in under funded communities, to teach you more about what's going to happen when you're an adult, right? Things are we're going to be learning about during the school time, where they teach us about mathematics, right, and algebra and all that. And you're like, well, how's that going to help me in my life? And it does help out, but there are other things that should be taught, and they are not taught during our schools at this time. And that would be things like healthcare, health insurance, picking plans. What's going to happen when I am no longer underneath mom and dad's plan? What's going to happen when I'm on my own as an adult and I need to go to the doctor? I can't keep calling my mom and dad to schedule my appointments. So it's really important for me to kind of help educate not only just myself, but my friends, my family members. As even as though I'm speaking more so to a younger community, I do also know that there are a lot of older adults in communities who have just gone through the motions of picking plants, and they don't even understand what they've been picking. They've just been doing it for years. Oh, they've heard their friend pick this plant. And so I think it's important for all of us to know this information, not just younger people, but even older people, different ranges of ages who are at different stages in their lives. Maybe some people are looking to retire, right? That's one thing that helped me when I was looking to really help my own family members when they were trying to retire, and how do they pick plans, and what's going to help them, and what is the benefits of choosing something, and things they were not aware of because they're not privy to this information. So for me, that is what's been fueling my passion behind this. So I'm going to speak a little bit this evening around some health insurance basics at this time, to give you all just a little bit more insight about when it comes to picking your plan. And hopefully after this, you will have a little bit more insight about, what happens when you go to the doctor, right? What to be out on the lookout for. Wait, I got a bill in the mail. Why do I get a bill? What happened here, right? I thought about having health insurance. And so what I'm going to do is just speak a little bit about some terms to give you a little bit more basic understanding. And I'm going to share a lot more related to cost sharing, because we know health insurance in this country is not free for everyone. It's not cheap, and it could be a bit overwhelming for some. And I do hear a lot of the data comes back. It's, what's the one reason why someone may go from, having their home to being homeless? And it could be just a matter of having insurance, whether it's home insurance, whether it's health insurance. Insurance plays a big part in that. And so if I can help provide you any insight related to the health insurance side of it, that's what I'm looking to do. So if you do have your questions, feel free to drop them in the chat or so, and we will look to go over them. But I will be discussing some basic terms at this time, just to give you a little bit more insight about what happens in the flow of health insurance. So, Sandra, if you don't mind just helping me out, letting me know if there are any questions that do come in, so that we can fill those, and I look to make sure I assist with answering everyone's questions. But the first thing I do want to talk about when we're talking about health insurance is these health insurance terms. And a lot of people don't know them, they've seen them and they just don't really understand what they mean. So some of the terms that I'm going to be talking about today will be related to the term copayment, the term coinsurance, term deductible. These are all terms that we may have heard before, but we don't really understand how it impacts us when we go see the doctors. I'm going to also be talking about things like out of pocket maximum. I'm going to be talking about preventative health insurance, right? And what that relates to. So feel free, like I said, to jump in at any time with any questions. If I need to go back over something, I do have a tendency to get a little excited. So I speak a little bit turbo mode at times. So if you need me to go back over something, I have no problem doing that. But of course, the first set of terms that I am going to speak about, like I said, are going to be coinsurance, co-payments, and deductibles. In talking about that, I mean, as a trainer, I do typically like a little class participation. So if you know of any of these terms, feel free to give us some reactions. Let us know if you've heard of them. Is there a term that sticks out that you've never heard of before? So I'm going to give a little quick pause there to see if there's anyone out there in the audience that knows what any of these terms mean, and can maybe give us a little heads up on what they've heard about before and what it means when they've heard these terms or how it's, been used with them.
And what needs to happen is that we, those of you that have Apple, there's a known problem with Apple and LinkedIn. So if you have Apple and you want if it logs you out, just go ahead and click on so that you can.
All right. Thank you very much for that information, Miss Sandra. And I think I do got some crowd participation. I see someone in the audience. Hello, Sharice. Yeah, the co-payment is the amount someone pays when they do go to a physician. It sounds like you've had to pay a few of those in the past. Exactly. So when we're talking about a co-payment, I'm pretty sure that's one of the most common terms that a lot of people do here, is a co-payment. And typically, a copayment is a flat fee as well. That's typically what you see when you're going to the doctor. So if you need, I like to think of it like a cover charge, right? It's something that you do have to pay prior to you seeing the doctors. Now, this is, like I said, the term that most people typically hear about. But there's some other terms that they're not nor as more familiar with, right? When we're talking about some of those other ones I mentioned, like deductible or co-insurance, right? So these are terms that are going to be applied to you as the person going to see the doctor, or going to the hospital. These are things that I would like to assist with giving you some insight on. So yes, something that you're going to pay when you go see a physician. You may even pay it at a hospital, right? People may say, hey, I tried to go to the emergency room and they're telling me I've got to pay before I can be seen. Yes, that would be correct, because you have to pay a co-payment before you're able to be seen with certain services. So please don't just start going to the doctors, like walking in there thinking I could just be seen. Be mindful of that information. Yeah, thanks, Sarah, for sharing your experience. Saying, yeah, you've had to go ahead and pay that before you could look to be seen, even at the hospital, right? That is something that's important to think about. Another term that I would like to share about that's not as common for people, which is going to be co-insurance, right? Co-insurance is another term, and these are reason why I'm sharing these terms. Like I said, is because the more you get familiar with them, the more you'll start to see them, and you'll start to say, that's where that's kicking in at. So we've got this thing known as a co-insurance as well. So that co-payment was the most common term, but co-insurance is going to be that partnership with the health insurance company. Okay. So this is where you're going to pay a percentage of your medical expenses. So typically with a co-insurance, there's a partnership with your provider, whether, excuse me, your insurance company, whether that may be like Aetna or United Healthcare or Cigna or Blue Cross Blue Shield. These are all different insurance companies that provide people access to have coverage, right? So that they can go see the doctors and go to the hospitals. And so this is a partnership. When you say, I'm going to sign up to have health insurance with Aetna, you are coming into a partnership with this company. And so what they're saying is, hey, we're going to partner with you and we're going to pay a percentage of your services when you go see a doctor or a go to a hospital. But then there's other things we're going to talk about, which are the terms of in network and out of network, right? We're going to mention that and how much partnership they're going to look to provide to you. So, an example if someone's asking, hey, what is a co-insurance? How I like to think of it is it's like a rewards program, right? You join a partnership with a company, you join a rewards program for being a member, you get some savings, some perks. So, you get some discounts, right? So, that's your discounts for going to the doctor's office or the hospital by taking part of this health insurance company. That's going to be your co insurance. So it's like you're both paying, you're both helping out with this. You do get a little bit of a discount because you are a member of their health insurance company. Right. Does anyone have any questions so far with terms? Am I doing good? Y'all have any other questions?
If she's doing good so far, can you please go to react and give her thumbs up so she'll know how good she's doing, please?
All right. Well, I'm gonna keep moving on a little bit because I got some terms, and I want to do open it up for questions and whatnot. But I do want to make sure that I give you that space. So I'm going to keep moving on a little bit to talk about one of these other terms, and this one right here. Oh wow, this is a big one that a lot of people are a bit confused about. They don't really like this term, but it's called the deductible. Oh my goodness, a deductible. Yes, the famous deductible. Does anyone here have car insurance? They purchased a car, you drive a car around. What happens if you get in some type of accident? The car insurance, keyword is insurance, the car insurance company is going to say, hey, we're going to help you out, but you got to pay this up front, right? That's your deductible, right? So, how I like to think about the term deductible is that the deductible is the amount of money that you've got to pay out of pocket before your health insurance company is going to look to step in and help out with that partnership program that they have with the co-insurance. That's where this deductible steps in at, right? And another tip that I like to think about when I'm hearing the word deductible is that I think of the word deduct, right? The word deduct means that something's being taken from me, and most likely it's my money. So I like to think about that way, to hear about a deductible. But I also like to think about we're talking about, nostalgia. For me, it's Black History Month, and I'm thinking about all the great things, that have come over the years. But I think about one of the toys that I got when I was younger. It was called a slap bracelet. Does anyone remember slap bracelets? Miss Sandra, I don't know. Maybe I'm not as young as I think. Slap bracelets may be a thing of the past, but I do remember those. And in order to activate those, I had to hit it on my wrist, and it would wrap around and get it started. That's another way to think about your deductible, right? That's how I like to think about it. I use my deductible, it's my slap bracelet. I wrap it around my wrist. It's now activated because I've paid all this money into it. It's a certain amount of money you have to pay before your insurance company is going to look to step in and help you out, right? Yeah, those were definitely fun. You can still find those. Laura, thank you for letting me know. I'm going to have to get on Amazon and go find me a slap bracelet so I can give them out so people can remember their deductibles and remember, hey, you use this slap bracelet, you've met your deductible. Now your insurance company is going to look to help you out and step in and start making some of that partnership payment on behalf of your health insurance. So, absolutely. Love that. Thank you, Laura. We're going to have to go get a whole group for all of us so that we can know when we've met our deductible. We're just going to label them. But yes, so those are some key terms that I wanted to share with all of you so far, to make you know that these are different things that you, as a person who has health insurance, would be responsible for. These are known as cost sharing or subscriber responsibility, member liability, all terms that you may hear. Okay. All things that you would have to pay out of your own pocket to go ahead and receive services. So people are like, wow, those are three different categories. I've got to pay a deductible, a co-insurance, and possibly a co-payment. Yes. And that's why it's important to educate people, because if you go to the doctor, you may think you're just going in there to see them for a cold. You had a little cough, or you try to go to the emergency room because you're not feeling that great. And the next thing you know, you're feeling better. You've already seen the doctor. You get home and you've got this bill. And you're like, I had no idea that this was going to happen. I didn't expect to see a bill for $700. I can't afford that, right? So it's good to let people know what may happen when they go to the doctor. They may be responsible for one of these three different terms, they could also be responsible for all three. So, depending on how they have their health insurance plan, and that's why it's important to read them and pick your plans and understand where you may be responsible for, because medical costs are not cheap. Okay. Health insurance companies are here to help you with getting you those discounts, right? But they can only help you, well, they can help you two ways. They can help you if you stay in network. One way that can give you a lot of savings. You can also get some savings if you go out of network, but the best way to get some savings would be to stay in network. So you don't find yourself coming out of your own pocket for a lot of these costs. Okay, because that can be an exorbitant amount that you weren't expecting to pay. You just went there, you weren't feeling well. And when you're not feeling well, you just want to feel better, right? Then you get a bill and you're like, "Oh, I don't know if I feel so hot anymore. I'm not feeling too well." But now we need to know how to avoid, if we're not feeling well, getting one of those bigger bills. How do we avoid that? How can we be prepared and say, "All right, if I'm not feeling well, I need to go to maybe an urgent care instead of the emergency room." Because when I look at my health insurance plan, I can see if I go to a urgent care, I'm only responsible for a $75 copay. But if I go to the emergency room, I may have to pay a $500 copay. That's a big difference. And a lot of people have been taught, hey, go to the emergency room if you're not feeling well. But that can be a very big financial burden for people. And that's not what we want to have people doing. So we really want to educate people on how to read their plans and understand what they're responsible for so that they know, hey, when I get a job, I don't want to pay this much money out of pocket. Yeah, thanks, Shrews. That is a really big difference, right? That's not something that some people are prepared for. You have to plan for certain things, and thinking about people who have given birth. That's another exciting time in someone's life, right? When you're giving birth to a child. But if you're not aware of how things cost, you may find yourself carrying a big burden of a bill on top of, you're trying to enjoy this exciting time in your life, but now you're hit with a bill. So it's important to educate people. I know for myself, as well as some of my friends, I have standing conversations about how to pick plans because it is very intimidating, right? You're not really sure what works for you and what doesn't. So being able to talk about some of these terms and seeing them when you get, information from your doctors or from the insurance company to compare is really, really important. Um, we get, has anyone ever heard, and I'm going to throw some other terms out here just to kind of fill where we're at. Has anyone ever heard of the term explanation of benefits? Have they gotten something in the mail that says this is not a bill, but this is an explanation of benefits? Yes, sir, you have. Love it. Anyone else? All right, Sharice as well. I'm hearing that as well. There's absolutely, getting an explanation of benefits is going to be a breakdown of what you get, your services, which you receive from your doctor's office, right?
And
Yeah.
before you go forward, Coach Pat had her hand up as well when you asked, has anyone heard of an EOB? And for those of you that are listening or watching the video later, please pay close attention to what she's getting ready to share with you in reference to the EOB, because it's something that we should all have in our hands at a certain point in time before we spend one dime out of our pockets. So please, Jessica, go ahead.
Yes, absolutely. Thank you. And so, yes, an EOB stands for an explanation of benefits, right? This is going to be when you have gone to the doctor, right? You've received some services. This is what the insurance company is going to send you to give you a breakdown of what type of coverage you just received, how much they billed the doctor's office billed them, what they were able to cover for you, and then what you would be responsible for. I know a lot of times you see this and you're like, I don't know how to read this. And you just kind of like let it go by the wayside. No, it's important to read this because you need to make sure, is this accurate? Is this in alignment with my health insurance plan? Am I truly responsible for some of these costs? And what that explanation of benefits does is it does break down line by line the type of services that you received. Okay. So when you go to the doctor's office, and I'm going to give you an example of, if you're not feeling well, or maybe you go, we'll start with if you're not feeling well, right? If you're not feeling well, they're going to bill it a line item, right? And say, hey, we treated this person for this service, and this is how much we're going to charge for it. Now, they may, once they charge for it, this is where you're going to see the break across your deductible, your co-insurance, your co-payments. So for your doctor's office, depending on your plan, you may have seen that you are responsible for a co-payment. You may have also seen there's a charge for your co-insurance. You may also see there's a charge for your deductible. But it's important to read this information and make sure it's accurate, because what's going to happen is the doctor's offices, they're going to send you bills. And if it doesn't match up to this explanation of benefits, you may have been paying for things that are not really what you're supposed to be paying for. You need to make sure it's in alignment with your plan cost, right? So it is important to review and make sure the charges were sent to you, so you can see that, right? So, yes, sometimes the explanation of benefits can come in the mail after your bill comes, right? Nowadays, they do have these portals where you can log in to see your explanation of benefits from the doctor's offices. I also urge you all to review your explanation of benefits before you even pay the bill, and so that you can at least call the insurance company and make sure, hey, did this go through properly? Is this according to my benefits? Because what I'm seeing here is that maybe I'm only supposed to have a $25 copay, but the doctor's office sent me a bill saying I have to pay 50. Maybe it didn't go through the insurance, or maybe they sent you the bill first, before the insurance can come kick in. So there are definitely different aspects of it that you want to be mindful of, where you may need to call into your insurance company and say, hey, let's review this. It is, advocate for yourself, okay? Because if you don't advocate for yourself, no one else will. So I definitely encourage you to advocate for yourself. I know calling the insurance company can be a little bit scary at times, but what I would say is that it is in your best interest to contact your insurance company if you have to, and just verify, what is my coverage? Those are questions that you have to ask. What is my coverage, so that I can make sure I'm not paying out of pocket, okay, for things that you don't need to. Yeah, it can be very time consuming. It definitely can, but it is worth the time, because it is great to know that you've just saved yourself a ton of money. This is not an ad for Geico. I'm not going to say you just saved a ton of money by switching to Geico, but you did save yourself a ton of money by understanding your benefits more now, right? By being able to fight for your own coverage and say, hey, I'm only supposed to pay maybe this 20%. I see that the doctor's office is billing me without that insurance coverage listed there. So there are definitely things that we want to keep in mind when we're talking about that explanation of benefits. You may also see there are times where you go to the doctor and maybe you say, hey, this was supposed to be a routine medical coverage, right? Routine preventative care, right? This is my routine servicing for my annual visit, and I shouldn't receive a bill. Well, here's a little free game for you here. If you go to the doctor's office and it's supposed to be for your routine checkup, when they ask you, hey, is there anything happening? And you tell them something else, right? What's going to happen is now they get a chance to bill on top of that routine servicing. They're not going to bill you for some additional medical costs, which would be why you may see in your explanation of benefits multiple lines, and it shows that you do have charges that you're responsible for. So it is really important during open enrollment times, that we take a look at our plans and see what they really mean. Give it a breakdown, what you're going to be responsible for, because with health insurance, you are stuck with that plan for the year. Okay, you're stuck with that plan for a whole entire year unless you have what is known as a qualifying life event, which would be if you gave birth to a child, you got married, you moved to a place where you lost access to your coverage, or the more famous one for our younger people, You turned 26. You got kicked off your parents' insurance, and now it's your first time picking a plan.
You turn 26, or if your parents are on Medicare, Medicaid, you turn 18 and you actually age off of their system, you also are responsible for picking your own plan. So if you know someone that is soon going to be 18, and maybe they're on Medicare, maybe their mom and dad are on a Medicare plan due to an illness, or maybe they're on Medicaid, it's important that you teach them, they're 16 now. It's important for you to start sitting down and having some conversations, because all of these co-insurance, these deductibles, they have no idea what that is. But they will have an idea if they get a bill and they don't pay it when they go to buy a house or buy a car, and that the information is showing up on their credit report that they had these bills that they didn't pay. While it's true that some areas, if you don't no longer medical debt shows up on your credit, there are some that are still showing up, and they will continue to show up, which is why it's important now, especially during African American Month, that we sit down and we talk to our young folks, our adults, whether we're at church, whether we're at home, grocery store, whatever, whether we're in the doctor and we see them in the doctor, right, with their mom and dad, but we know, we could tell that they get ready, they're probably going to soon have their own insurance. It's important for us to have these proactive conversations. Back to you, Jessica.
Oh, thank you, Sandra. Absolutely. It's super important. I wish these were conversations I was having fresh out, because I'll tell you this much. Before I started learning about health insurance, the only term that I all knew, like you all, was co-payment. It's the only term I knew. Next thing I knew, it was time for me to become a big girl and get my own job and start getting, health insurance. And I went to work for a company, and I said, no, I don't really know if I need health insurance. I'm not 26 yet. I can stay on my parents' insurance, right? And then came the day where I turned 26, and I didn't know much more. And I got this lovely packet in the mail when it came time for me to pick my own plans, and it was called Cobra, right? Which is another term for all of you. It's Cobra, which is going to be a continuation of benefits. And so for me, I was like, oh, well, I like the plans that I had. I like my doctors. I just pay them a co-payment, and I go about my merry way, right? Um, yeah, it was a wake up call for me, because I opened that packet in Cobra, which is a continuation of the plan that you had. What happens is you're now responsible for paying the entire amount of the coverage. So before, it may have been getting like a payment from the a group insurance, right? Where they were making a payment towards it, and then you had your responsibility for what you would pay towards your premium. But now it all fell on me to pay all that. And as someone who this was their first time ever finding out about this and seeing that it was just me for my own coverage myself, and the bill was over 900 something dollars, it was a sticker shock for sure. I was like, hold on, I don't know anything about this. And from that point, I went and learned about the plans, and I went and found my jobs plan, and learned a little bit more about it, because I was like, that is just way too expensive for me to be paying for health insurance just because I like paying the copay that I had before. But I didn't understand that once I turned 26, I would have to start making my own plan choices, right? And what that meant for me. And so a lot of times, a lot of young people, they just go like, oh, I'll just pick a plan, I'll just click it. But then I started getting bills. I started trying to go to the doctor, and I had to start paying things, and I didn't understand it, because I did not understand what it was to have a co-payment, what it was to pick a plan that had a high deductible, and that meant that I would have to pay all of that money before my slap bracelet started activating. I didn't realize that. And so, knowing this information now, I think it's important to educate a lot of our friends, our peers, because they're going through the same process, right? They don't know. There's a lot of younger people who are now also being the ones that have to um, help their parents pick plans, right? And they're being the ones to say, okay, well, let's navigate through this together, but they don't even really know. And so it's a really great time for us to all sit down with each other and say, okay, let's talk about what this is and what that means so that we don't get those sticker shocks, so that we know, okay, I know that I go to the doctor really frequently. Maybe I don't need a plan that has a big deductible. Maybe I need a plan that has no deductible or very minimal, because I can't afford to pay all this out of my own pocket up front. Maybe I need a plan that my insurance company pays, 100% of my co-insurance, so that, I don't have to pay anything out of pocket for the services outside of maybe my co-payments. So these are all things that we need to take into account to remember, hey, when I'm picking my plan, this is important. This is my life. I have a lot of doctor's appointments coming up, or maybe it's like I got a $3,000 deductible that I have to pay. I'm gonna stay healthy. I'm gonna do what I need to do to stay healthy, so I don't have to go to the doctor and spend that money as much, right? Or educating us about different things on how we can find ways to offset if there comes a time where we may need to go to the doctor, and how can we put aside some savings for that. There's a lot of different accounts known as like a health savings account or a flexible spending account, depending on your plan type, will determine what you can use to save funds for the year, right? A flexible spending account is something that you can use to help you pay for cost of services up front for that year. That would be something that you can use, and you can load pre-taxable dollars into that. That is a great opportunity for people who know that, let's say they have some physical therapy coming up in the new year or so. They want to set aside some money that will allow them to be able to complete those physical therapy appointments without putting an additional financial hold on them. But the thing about a flexible spending account is it's a use it or lose it situation. You got that whole year to use it. So keep that in mind when you're thinking about different ways to save money to utilize for your health insurance coverages. Whereas a health savings account is going to be another option. I like to point this out for a lot of my younger people as well, because a lot of times we don't go to the doctors as often, right? But depending on your plan type, if you have a plan that does have a high deductible health plan, many younger people aren't going to the doctors unless it's for a routine servicing. And with routine preventative servicing, those services are covered at 100%. At no cost out of pocket to you, right? So if you do go for those services, you don't have to worry about paying out. But you can also contribute to what's known as a health savings account, which is, I love it. I'm an advocate for it, because what you can do is you can put away pre-tax dollars to help save in the event that you do need to go to the doctor, and or maybe you need to have a surgery or so. This is money pre-set aside for you. And it's a triple tax advantage. I don't know if y'all understand how exciting that is, but like, I can invest this money once I've saved over $1,000 of it, which is really, really great, because not only are we talking about you saving money to help prepare you for, if you need anything for your health insurance, but you can also invest it in the future. You can take it with you, regardless if it's for, one company or for another company, you can take it with you, unlike your flexible spending account. So these are definitely different terms that I want you to be mindful of, be on the lookout for, to think about. So you can start having conversations with your friends and family. Say, hey, did you know about this? Did you know I can save money and put money away for that in case of a rainy day, or I can use it for, other things. A lot of people think health savings accounts and flexible spending accounts are just for band-aids and things at the end of the year. It's not. It's for so much more. They also have websites, the FSA store and the HSA store. I would encourage you all to look at those so that you can take advantage of them. I mean, they even have like massagers on there, right? So, like, if you are a person who works out a lot, and you need to sore, you're really sore, you need to, try to go ahead and say, hey, I need to get some assistance with that. You can go on there. They have massagers for that. They can use it for, sunscreen, different things. So I think it's super helpful. These are all things that I've learned about, and I've helped me out with making sure that I keep my costs down with going to the doctors. I keep very, very mindfulness of the types of plans that I pick and finding different ways to save, as well as sharing this information with friends and family. I do keep standing calls when an open enrollment time comes to try to help my friends and making sure that we pick some plans that are best for us. But uh, this is what I'm going to pause at this time because we've got about 15 minutes left. I'm seeing inside of this program. So I did a lot of talking this evening, and hopefully it was helpful in giving you some tips and terms that you were not made aware of. So I'm going to open it up at this time. Sandra, if there are any additional questions that are coming in, I'm not sure. I'm in LinkedIn. If I've missed anything or if you've got any other questions for me at this time.
Thank you so much, Jessica. Yes, you've given us a lot of information. We did have Yvette come up one stage. I think LinkedIn kicked her out. If she wants to come back on the stage, please, Yvette, go ahead and raise your hand. Before we go further, though, I do want to take the time right now to thank everyone from Facebook that's listening in or watching, or maybe you're going to listen in a little later or you're going to watch a little later. If you have questions past this time, please go ahead and send them to me. You can send them to my email. You can send them to me through either Facebook, LinkedIn. Many of you will have my email address. Our website is another way that you can reach out to us. And our website is www.medihelps. And Medihelps is spelled MEDIHELPZ.com, where you can ask those questions. I actually also want to take the time now to thank those who are in LinkedIn, who are listening, and who have been here for a while. I want to acknowledge them with all the love and the blessings that I have within me and that I carry forth with me from my ancestors. And so I'm going to say thank you to Joshua, Bernard, Sarah, Darlene, Carolyn, Patricia, Sheree, Paul, Jay, Terrence, Molly, Lark, and Yvette, Cousin Riley. I'm going to say thank you so much. I want to say, and I'm going to say thank you so much for taking the time to listen in. If you have a question that you want to have answered, please go ahead and raise your hand so that you can come on stage. Once again, if you get kicked out of the room, please go ahead and just re-enter the room. Just hit it again so that you can re-enter it. I do have a question for you, and we both can answer this. And then I'm going to actually share with everyone a personal story that happened to me today that goes directly to what Jessica just stated about your reading your statements to make sure that what you're being charged is what you're supposed to pay. If you don't get an EOB, though, before you get you get a claim, you get a claim and you don't have an EOB, right? Don't pay it. Do not pay it until you actually get that EOB in your hand, so that you can read it to ensure that what you're receiving is what you're supposed to receive. All of us in this room have heard the word lately called medical debt. There are a lot of individuals who are in medical debt that shouldn't be, but they're there because they haven't read that EOB and they are just paying stuff, just going ahead and paying it, thinking it's theirs to pay. 9 times out of 10, when you get 9 times out of 10, when you get a bill and you pay it before you get your explanation of benefit statement, and you call a hospital or a doctor and say, "Hey, I got this bill and I'm looking at the EOB now, and they don't match up. I think I paid too much money." The chances of you getting that money back immediately are slim to next to nothing. Why? Because they've actually already added that in on their accounts payable, on their accounts receivable side, which makes them look good because they're in the red because they got all this money that they shouldn't have, but you sent it to them, so they got it. What they will do is they will offer you a credit. Well, I don't want no credit. What am I want to come back to you? I want my money back. That's what I want. I want my money. They'll give it to you, but you're gonna have to wait for them to give it to you. Plenty of times, what people don't do, which is what they should do, is they look at the insurance company, which is why I say we got to stop this blame game. They look at the insurance company and say it's the insurance company's fault. Well, if you don't reach out to your insurance company could be your best friend. If you don't reach out to your insurance company, and you're employed, if you're employed, you haven't, if you're employed, even if you're not employed, most that are not employed that have Medicare and Medicaid don't fall into this. But if you're working and you have an insurance plan, your employer, through their pocket and through your pocket, are paying for you to have insurance. Why would you pay to have a service and not use it? So that's exactly what happens when you go to the doctor or you go to the hospital and you need help because you're getting billed or you don't understand what the bill is, right? You don't call your insurance company and say, I need to get somebody on this phone with me that can help me, and I'll stay on the phone or you can call me back because this bill came and it's not right. Use what you are paying for. Please stop throwing your money away and not using it. Your insurance company could be your best friend, but they can't be it because they're not mind readers. And if you don't know it, and this is going to go to a question that was asked in the chat. If you don't know it, are they going to tell you? Why would they? That's money you're taking away from them. Why would they? They're not going to tell you, which is the importance of having an organization such as Charms that's out here teaching you what you need to know so that you can stop spending all this money and losing your house and not eating and all this kind of stuff because you study, you're in this influx of healthcare. It's no reason for it. You have resources out here. You really need to go along to using them. And Sarah, you asked, does Medicaid alert the client to the fact that your son or daughter is going to be 18 soon and they'll actually be aging out of the system? So they need to get insurance on their own. The answer, it depends. The answer, you really need to know your resources. The answer, you can't depend on them to tell you anything, right? It's just not going to happen. Which is why you really need to be taking care. You really need to be taking the advantage of the resources that are in your community that are there set up for that. So should you have a question, you can go to them and ask. A lot of times we get mail that says United States government, Department of Health and Human Services, or whatever. And what we do is we put it on our dresser and say, oh, I'll get to it later. When is later? Right? Oh, I'll do that tomorrow. When is tomorrow? Tomorrow never comes, right? So we can't depend on Medicare and Medicaid telling us this. We can't not depend on them. We can't say, yes, they're doing it, no, they're doing it. But what we can say is there are a number, especially in the under-resourced and the vulnerable communities that do not have this information. So when their children age out of the system, they don't have insurance. They just really don't until they go ahead and they get it. And trying to get your 18-year-old to sit down and pick out an insurance plan. I mean, hey, if you have had luck with that, that's great. But it's not in reality, it's not gonna happen. So before we go forward, I do want to call Paul is up on stage, and I'm not sure if he has something to say or if he wants to share some information, but whatever it is, I'm going to go ahead and allow him to do so. And
Say,
Paul,
hi, Sandra and Jessica. Thank you so much for holding this space, and it was really insightful. And I'm kind of curious for you both. Over the past couple of years, I've been hearing a lot about health sharing as kind of the new version of health insurance in the sense that works, and I'm just kind of going off of information that I was told and what I know, is that the way that it works is it's based off of your health and your age age instead of how much money you make. And I'm kind of curious for both of you, like, what are your thoughts on it, or if you're even familiar with it, and just any kind of insight that you could share.
Jessica, do you want to go first or do you want me to go first?
I can share. As far I do know that
And you are correct in what you say. What is important to know about the health sharing is that you have to look at, in those states where health sharing is allowed, right? You have to look at, because you sort of kind of have to look at the health sharing the same way as you look at the marketplace. And you have to actually look to see what benefits are in that health sharing. What is it going to cost you? Are your doctors that you need to go, are they in that plan? Because if not, then you might want to say, okay, well, let me take a look at what's in the health market for those that are able to afford to pay for their own insurance. You might want to look at and say, hey, what, where am I going to do best at? Am I going to do best getting into a health sharing program, or am I going to do best going into the marketplace and paying for a plan off the marketplace so that I can ensure that I have the coverage that I need to have should I get sick? But rest assured, no one should be without health insurance, because we just COVID COVID came in, her and her family set up shop and said we ain't leaving till we get ready to leave. And they still here, right? They still hanging on. They still here. They done brought their cousins, their aunts, their uncles. And meanwhile, while they doing all this with our health, right? Our health is suffering. So we definitely need to have insurance of some type, whether it's a health sharing program, whether it's a Medicare, Medicaid, Medicare program for those that qualify, whether it's, I'm going to do a concierge, and this is the other thing. I'm going to do a concierge service, right? Where you go to one doctor, you pay one bill. They set you up a lot of times with a payment plan. You pay that one bill for, what you need, but you need to know that when you go to a concierge service doctor, a lot of times they don't have privileges in a hospital. So if you has to be placed in a hospital, then you would actually have to see those doctors at a hospital until you were discharged. So all of that goes into the thinking of, okay, well, what insurance plan should I get? What, I mean, and there are so many other ins and outs and intricacies of health insurance that we don't want to just stop on, the health sharing, the HMOs, the PPOs, the EPOs, because there are others that are out here that each of us need to know about. And and Paul, and I thank you so much for coming on stage and asking the question, because we all need to know, because there are many who are either, whether they're listening to it tonight or going to watch it at a later point, are going to be like, well, what is health sharing? Well, what is this and what is that? And so that's why we're here tonight, to try, in this short period of time, to give out as much information as we can, to let you know that, hey, we're here. If you need help, reach out. If you're stuck, reach out and say, hey, what plan do you think I should go into? Due to my full-time day job, I'm not able to get into, well, here's the plans and explaining and all that. I can't do it. I'm being honestly transparent. I'm not able to do it, because then it's actually becoming a conflict of interest. However, I have 5 awesome board members that I can call and say, hey, this person needs this. Can you get it to them so that they can help you get the best out of your health care, help you understand those health insurance terms that you really need to be paying close attention to. So that is what I had to say. What I am going to do, because it's now 7 o'clock, we're at the top of the hour. If anyone has a question, please go ahead and raise your hand. I am going to go ahead and let Jessica, our loving host, our loving guest, I'm going to let her close the evening out with her parting words. I am going to tell you that tomorrow is going to be just as lit as today is, because tomorrow we have author Rosa Antonini, and she will be discussing her book, Zero. And we have one person, I'm going to call her up on stage, Miss Darlene. She will be discussing her book, Zero Sum Game Defined. And you want to hear all about what she's doing with the proceeds from her book. Hold on for 1 second. I'm going to let Darlene up. Darlene, I'm not sure why I'm not. Jessica, see if you could bring Darlene up. Do you see her?
I do. Give me 1 second.
Okay.
Yeah, I'm unable to bring her on stage as well.
Yeah, wow. I don't know what that's about. Let's give her. Darlene, if you can go out of the room and then come back in, tip tap to join and come back in, we could try to see if we could bring you on stage. Okay, so while we're waiting for Darlene, I'm going to let Jessica go ahead and give us some parting words, Jessica, please.
Oh, absolutely. So thank you once again for having me in this space and being able to help kick off this lovely series of events that we are having for Choms in this upcoming month for Black History. But my parting words would be advocate for yourself. um, you know, get to know your health insurance company, get to know some of these terms, because it does impact your life. It does impact, your finances. It does impact how you can go about moving around with going to get care. And so I do just want to encourage you all to, give yourself an hour, right? 30 minutes to just, be mindful, take some time for meditation and being with yourself. And then, do something physical, right? That's my, time. Just give yourself an hour in the day to do that, because within that time, you'll be able to just sit still and be quiet and just say, okay, what do I need to do for me? And I think that that's really important for people to just think about, especially in these times. Your health is really important. And the more you take care of yourself, the less you'll also have to spend at the doctor's office, and having to use some of these cost sharing terms, and being, set with these financial burdens. So try to take at least an hour out of the day for you. 60 minutes. I know it may seem like a lot when you say an hour, but when you break it down, 60 minutes in the day, you deserve that for yourself. And, advocate for yourself. That's what things I would say moving forward, because if you don't, no one else will. And so I wanted you to feel empowered. I know it can feel scary when you're talking about dealing with health insurance companies and billing companies from hospitals and doctors' offices. But this is for you in your life, right? So advocate for yourself and make the time for yourself.
Well, thank you for doing this fantastic event, and also thank you to Jessica for all of the wealth of information you shared. Very insightful. I did have one question of an experience that I had with falling into the infamous donut hole when trying to fill a prescription for my husband's inhaler. And I had heard the term before, but I wasn't really familiar with it until I was informed that his inhaler was going to go up to $237 a month. And that's when I first got to the point that I needed to get more familiar with the whole donut hole. Fortunately, I was able to ask enough questions to find out that there was a generic available of the inhaler that went costing $0 instead of $237. But if you could just share a little bit of insight on that. I know that we're running short on time, but it really caught me by surprise.
Sorry, I don't know if y'all can hear me.
Yes, I did. I took you off mute. It was on mute. I took you off.
Okay. Just let me. Okay. Darlene, can you hear me as well?
Yes, I can hear you.
Okay. All right. Just making sure. So you're talking about as far as the difference between like finding prescriptions that are generic versus like name brand and different things with that, and how it could be impactful financially, correct?
Right, just really understanding when you get to that point. And I also was hearing the term about catastrophic, and it really kind of threw me for a loop.
Sorry, I'm trying to turn the volume up, so my apologies. So when I think about talking about like I guess the donut hole, when we're talking about prescriptions, I'll tell you, prescriptions is how insurance companies that's how they make their money. A lot of prescriptions. So it is important to think about asking the right questions when you're talking about getting a prescription filled. So, is this something that you do want to always ask? Is there a generic? But be mindful when you're asking, is there a generic? Have your doctor review it. There are a lot of different programs like Good RX and things of that nature that even though there may be a brand name for it, you can still get some savings on it. You don't have to worry about that cost, because sometimes some people cannot take the generic version. There are side effects that they may have. And so you may find yourself having to utilize the name brand drugs and whatnot. But it is really important to just have those conversations with your doctor's offices and let them know, because there is funding out there to be able to save money if you do need to utilize these different prescriptions that are, name brand versus generic. And so it is a lot of legwork at times in the beginning, finding out if there's like any type of mail order options that can use where you can find some savings. Um, and so it is important to ask the proper questions to see if there are other prescription that you can use in the meantime, or finding different ways to test out different dosages from the doctors to ensure that you're not paying out of pocket. But I will say insurance, when it comes to prescriptions, they are typically the where you're going to find a lot of the out of pocket costs to you, because that's where a lot of the money is made in big pharma. So as much as we can, my opinion is to see if we can try to limit being on prescriptions. I know there's some people that can't, but that's why I say, try to take time for yourself and be a little bit more healthy so that we can try to avoid having to get on that. But yes, there are definitely different levels to it. There's different specialty drugs. It's a little bit more complex than I don't we have time to go into. So I will say I'll leave it at that. Try to speak with the doctor more, to always ask before like they write a prescription, to confirm if there are different options available, because doctors make money off of what they write off too, right? If they write you a prescription for a name brand, they may get more money from the insurance company from that versus using a generic brand. So ask them the questions before you just accept, prescription for like a name brand versus a generic.
Thank you so much for that information, Jessica. You're absolutely right, because I would never have found out about the generic if I didn't specifically ask. And, I wasn't concerned about a generic initially because there was no cost, but I learned pretty quickly on that. So thank you for that response. I appreciate it.
Absolutely.
And I also want to share with people that there are prescription firm there are organizations, nonprofit organizations out that are designed to help you with the cost, with paying for the cost of your prescriptions, whether it's a scholarship or whether it's funding that they have that they use for that. Two of those programs can be accessed by going through PAN, which is PAN. They help. They do have, of course, they do go by your income, but they do have grants that are available for people to help them pay for certain prescriptions. Darlene, you have my information. So if you want to reach out and say, hey, Sandra, is this something that they will cover for us? I can take a look and see. There's also the Patients Rising organization. You can you can actually go online to Patients Rising. So Patients Rising is two words, PATIENTS. The second half of that is Rising, RISING. You go on their website, you'll look under concierge services. They will actually be able to also assist you with finding the prescription or finding a lower cost for you to get your medication. Those are two that I know that do in fact help with that area. You also, and the other two that I do want to mention is you do have findhelp.org that can help you work with you to help you find lower cost prescriptions, as well as 211.com that works on a larger scale with other nonprofits that may be actually also able to assist you with finding the medication that you need at a lower cost. Once again, of course, they all go according to income. Some income guidelines are better than others, but they are available and they are out there. And that would be, Jessica, do you have anything else?
Sorry, I'm trying to unmute myself so that way they can hear me as well. So I apologize. I got kicked out. There we go. I actually do not have. I did put in the chat comments about GoodRx as another option for thinking about if you're looking for some savings for your prescription options. They do also provide discounts and coupons that you can use. One last thing I would say is just to be take a look into finding out the network status of the uh, pharmacy, because that can also make a difference, where you may be able to find yourself getting a lower cost if they are preferred in network pharmacy versus if you go to one that is out of network. And that is something to keep in mind because the pricing does vary with that.
With that being said, I want to wish everyone a very, very lovely evening. Thank you so much for joining us tonight. Please stay on the lookout for the remaining month of February. As stated when we first began, we have a different senior subject matter expert coming to love on the African American community and all that support the initiatives put forth by us to have the same access as everyone else has. That's what we want. We want to actually have the same access that everyone else has to good quality health care. So with that, I'd say good evening and thank you again for coming.
Thank you, everyone. Have a great evening.
Girl, I'm trying to unmic you.
Oh, I'm unmuted.
Oh, okay. Hold on for 1 second.